Good evening, my name is Emma Dye, and this is my Module 5 Outcome Achievement Reflection video. I'll start off by saying everything went great this week, and my personal opinion, as always, there's room for improvement, but I did, I think, the best out of all of the exams so far in my maternal newborn. It definitely helped that I just had my son, but that felt pretty good to see. There's, again, room for improvement on the pediatric assessment, but it does certainly help to know that that's an area I need to study. So this week we're also talking about an instance in which we showed leadership with our interprofessional team during a clinical experience. So the best experience I have to draw on, I believe I talked about this in an earlier video, so forgive me for sounding redundant, but there was a nauseated patient who began vomiting that we needed Zofran for. So I am fortunate to have prior experience as a paramedic where my leadership skills in an interprofessional setting are imperative to how I do my job. I also have worked with medications such as Zofran before, which was what was appropriate for this patient. So ultimately, what this led to was me asking the nurse if the patient had a PRN prescription, which she did not, and that led to the need for an order from the physician and a call down to pharmacy to get those medications sent up to us. I felt very fortunate to have the ability to see this role of mine as a paramedic shifted to what it will be as a nurse. To be a patient advocate and show that leadership of, okay, this is a part of the patient care that I know that they need assistance with to help manage the symptoms they're currently experiencing. But also do that appropriately according to how that flows with an interprofessional team in a hospital setting. Like I was talking about before, that entails getting orders from a physician, so on and so forth with the pharmacy. That said, though, it felt really good to fit into my role. I know this sounds like I'm kind of taking a step back from leadership, which is, leadership is the point of the video this week, but ultimately I think leadership can be doing your part and then letting your team work as well, knowing your place and letting everybody else assume their role instead of taking over unless it's necessary to do so because somebody's making a mistake. And that's something that was pretty challenging to learn as a paramedic, where I was in charge of an entire scene of firemen, potentially PD officers, my partner, the patient, the patient's family, all of these things. It's definitely a role shift to show a different kind of leadership in the nursing setting. But again, I'm so thankful to have my previous experience to draw on because it helps me feel secure in the knowledge that I currently have about how things flow and provides me a fantastic foundation and in my personal experience to build on while working with folks in different interprofessional settings. We talk a lot in nursing school about how we are the liaison between different members of the patient's healthcare team, including, we talked about physicians and pharmacists, but also occupational therapists, social workers, speech pathologists, so on and so forth. And demonstrating leadership will also look like demonstrating communication and patient advocacy in these types of settings where we're working between a lot of people and communicating with a lot of different folks. That's something I'm very excited to learn how to do as we go along with our next clinical this coming weekend, as well as moving forward just in the nursing world itself, because it definitely seems like a skill that I will have to continue to build on, that I won't really feel comfortable till I know my hospital or facility system, as well as the people I'm working with and how this flows. Thank you for listening.